Hi, how are you? I'm Jack, a hospital nurse, and welcome to Vital Steps, the podcast where we explore the questions we all ask ourselves. And Dr. Adler responds with the wisdom of over 25 years helping older adults. Today we're going to talk about something that, honestly, I think we've all felt at some point: the restless mind. Have you ever found yourself unable to sleep because your mind just won't stop racing? Or felt a tightness in your chest and didn't know why? Well, what you're about to hear today might help, because we're not just talking about a very common issue in older adults. We're also introducing a tool that can help you regain balance, peace, and control over your daily life. A simple tool that doesn't require pills or special equipment. Just your attention. And pay attention, because in a moment, we'll discuss something many seniors are doing without realizing it's making their anxiety worse. But first, welcome, Dr. Adler.
Thank you very much. I'm really glad to be here to talk about a topic that, although often overlooked, has a huge impact on the quality of life of older adults. It's very common to hear that feeling nervous, restless, or having a constantly busy mind is just part of aging. But I want to be clear, that's not true. These symptoms are neither inevitable nor normal, and they should not be accepted as conditions without a solution. In fact, these feelings are often signs that our mind is overloaded, tired, or stressed, and needs a space to rest and recover its natural balance. Fortunately, there are very simple, accessible, and effective tools to calm the mind and bring back that sense of peace and well-being that everyone deserves. One of the most studied and recommended practices is what we call mindfulness or present moment awareness.
Doctor, I've heard that word, but honestly, I don't really know what it means. Is it like meditating? Is it something religious? How does it work?
That's a very common question. Mindfulness is not a religion, nor is it a complicated technique. It's simply paying attention to the present moment. It's a practice that invites us to live in the present moment with full awareness and without judging what we feel or think. It's not about forcing the mind to be blank or to stop thinking, but about learning to observe our thoughts and emotions kindly without getting swept away by them. For example, noticing how you're breathing, how your body feels, what emotion is present, without judgment. This reduces stress, slows heart rate, and calms the mind. And the best part, you can practice it anywhere, even sitting at home. Why do you say this could save us? Does it really make a difference in physical health too? A big difference. Recent studies show that mindfulness helps improve sleep quality, lower blood pressure, and reduce chronic inflammation. And in older adults, that's vital. For example, someone with chronic pain who learns mindfulness can reduce their use of painkillers by up to 30%. And when someone sleeps better and feels less anxious, they also move more, eat better, and even think more clearly. Here's a real-life example. At an adult day center in California, a group of older adults practiced mindfulness for 10 minutes a day over 8 weeks. The result? Less insomnia, better memory, and improved mood. In another study in Spain, seniors who participated in a 12-week mindfulness program with just 15 minutes a day showed a significant reduction in depression and anxiety levels and marked improvements in concentration and chronic pain management. Many reported feeling more energized and motivated in their daily lives.
In a moment, we're going to talk about which foods might be inflaming your brain without you even realizing it. But first, I want Dr. Adler to explain how to start practicing this, without needing to go to a center or read complicated books. If someone listening wants to try this, how do they do it? What should they do at home?
First, find a quiet moment in your day. It can be right after waking up or just before going to bed. Sit on a chair, close your eyes, and simply focus on your breathing. Inhale, exhale. When your mind wanders to another thought, that's okay. Just return to your breath. With just 5 minutes a day, you'll start to notice a difference. You can also practice this while walking in the park. Feel your steps, listen to the sounds, notice the colors. That's mindfulness in motion. Another helpful exercise. While washing your hands, feel the water, the temperature, the soap. That trains your mind to stay present. Here's something curious. Many older people believe that watching TV relaxes them. But in reality, if they're watching negative news or fast-paced images, that can actually increase anxiety. In contrast, just a moment of conscious silence can work wonders.
Doctor, you mentioned that certain foods may inflame the brain. Which ones are they? And what can we eat to keep our minds clear?
Yes, the brain ages better when we avoid certain foods. Avoid excess sugar, trans fats, like in ultra-processed foods, and excessive alcohol. Prefer berries, like blueberries, turmeric, fatty fish, like sardines or tuna, walnuts and green vegetables. An ideal breakfast, oatmeal with walnuts and banana. Simple, accessible, and great for your brain.
Doctor, let's go over some common questions we get from people about this. There's still a lot of confusion, and we hear these things in nearly every consultation.
Of course, I love it when there are questions. It means people are curious. Let's go with the first one.
First question, and we hear this a lot. Do I have to be in complete silence to do mindfulness?
Not necessarily. That's a very common but incorrect idea. Mindfulness can be practiced in any environment. What matters is your intention. You can be walking, cooking, or even washing dishes. What changes is your focus. You're paying attention to what you're doing, to how your body feels, to what you hear, see, or smell. That's enough.
What a relief. Because many people tell me, my house is noisy, the TV is on, how can I do this? Now I see you don't have to turn off the world. You just have to turn on your attention. Second question, do I have to practice every day for it to work?
Daily practice would be ideal, yes, but it's not mandatory. Even if you do it 3 times a week, you'll see results. The body and mind appreciate every moment of conscious pause. Like I always say, 5 minutes with full attention is better than an hour in a rush.
That's encouraging. Many older adults get frustrated thinking they have to do long sessions, 5 minutes. That's doable for everyone. Third question, and it's key. What if I feel like I'm not doing it right?
That's a very common doubt. But mindfulness is not a competition or something you do right or wrong. Each time you notice your mind has wandered and you choose to come back, that is mindfulness. It's training the mind like strengthening a muscle, with patience and no judgment.
I love that comparison to a muscle. It helps us understand that, like everything in life, it takes practice, not perfection. Fourth question, also very important. Does it still help if I have mild dementia or memory issues?
Absolutely. Mindfulness can help reduce stress, improve emotional state, and even slow down mild cognitive decline. It doesn't replace medical treatment, but it's a great complement. There's strong research backing this. From a neuroscience perspective, we know mindfulness supports neuroplasticity, the brain's ability to adapt and form new neural connections, even in later years. That means an older adult, even with memory challenges, can improve attention and emotional well-being through regular practice. And one important point, for people with mild dementia, mindfulness exercises should be short and guided. For example, using a calm recorded voice to help them notice their breath or observe an object in detail can be very beneficial. It also helps to incorporate visual or tactile elements, like touching soft fabric or looking at a flower, which stimulate the senses and ground the person in the present.
That's so valuable. Because families often think there's nothing else to be done. But with simple exercises like this, they can support better, connect more, and even share a beautiful moment with their loved one.
Exactly. These exercises won't cure anything, but they can help the person feel calmer, less confused, and sometimes even more emotionally connected with their loved ones. It's a simple tool, but a powerful one.
Doctor, thank you for answering those common questions and clearing up some of the confusion. Now I'd like us to talk about a very important issue for our older listeners: blood pressure. Can mindfulness help with managing high blood pressure, which affects so many seniors?
Yes, absolutely. Several studies have shown that regular mindfulness practice can help lower blood pressure. By reducing stress and anxiety, key contributors to high blood pressure, the body relaxes and cardiovascular function improves. It's not a substitute for medication, but it's a valuable complement for overall well-being.
Doctor, do people need an app or professional to practice mindfulness, or can they do it alone at home?
While there are many apps and resources that can help, They're not essential. What matters most is starting with simple, regular exercises. That said, for some people, having a guide or app in the beginning can provide structure and motivation. The key is finding what works best for each individual.
Doctor, is it normal to have trouble concentrating when starting mindfulness?
Absolutely. It's very common. The mind tends to wander, especially if we're not used to focusing fully. The key is patience. Every time you notice your mind has drifted and bring it back, you're training your attention. With practice, it becomes easier and more natural.
Doctor, many patients, especially those living with family or caregivers, ask if mindfulness can help them have better relationships, fewer arguments, or less misunderstanding. Does it really help?
Yes, a lot. When we practice mindfulness, we develop greater emotional awareness. That means we begin to notice our emotions before they take over. For example, if I start feeling irritated, I recognize it right away, and then I can choose how to respond instead of reacting automatically. It also increases empathy, because when we're more present, we truly listen. And when someone feels heard, relationships shift. Older adults often tell me, I feel more connected to my children, or I enjoy my time with my grandchildren more. It's not magic, it's presence. That's so important. I often hear seniors say they feel lonely, even when living with others, like no one understands them, or there's no one to talk to. Maybe the solution isn't just talking more, but learning to be more present when we share moments, right? Exactly. Being fully present with someone, without judgment, without planning your response while they're talking, is a powerful gift. And that kind of presence can be trained. That's why mindfulness isn't just for better sleep or less stress. It also improves the quality of human connection. And in later life, that's as essential as good food or exercise.
Does this work quickly, or do you need to practice for months?
In many cases, people notice changes in the first week. They sleep better, feel less tense. The important thing is, you don't have to do it perfectly, just start.
If you're listening to this and feel tired, anxious, or struggle to rest, you now know there's something simple you can try: breathing with awareness and being present. Let's quickly recap. You can start with just 5 minutes a day. You can do it sitting, walking, or even while washing your hands. It doesn't matter if your mind drifts. Just come back. And what if you try it today? Maybe right after this episode, you just sit and breathe. Also, we'd love to hear how it went. If you have questions or want to share your experience, you can write to us using the form in the episode description. In the next episode, we'll be talking about a hot topic. Do we really need supplements after 65? Or are we wasting money on something that doesn't work? Don't miss it. And if this episode was helpful, share it with someone who needs it. See you next time, Dr. Adler. Dr.